In this short video, we'll cover why employee confidentiality is so important to health at work. Here's a common scenario similar to what you may have come across at work. You are concerned about a colleague's health. Maybe you have noticed a change in their behaviour, something that seems unusual for them. Maybe their performance is deteriorating. What do you do? Is it the right thing to do to speak to them directly? Should you approach their manager? What if the colleague separately approaches you and tells you that they're worried about their own health? What would your next step be? It is important that issues where health impacts work, or vice versa, are identified and addressed. Otherwise, the situation may get worse. On the other hand, addressing employee health issues in a workplace context has its challenges because employee confidentiality is paramount. It's understandable that people may not want to share the details of their health or even personal issues that are impacting their health with their employer or their manager. But this means that managers have to be aware of how to approach situations when they're concerned about a colleague's health carefully. One useful option for organisations to be aware of is to offer to refer employees to occupational health. Occupational health is a medical specialty made up of clinicians with expertise in how work affects health and how health affects work. They can provide a confidential consultation where the employee may be more willing to open up about what's going on with their health. This information can then be analysed to make a management plan to help address both work and health. Strict professional boundaries means what is discussed in occupational health consultations remains confidential and would not be shared with an individual's manager or their organisation without this individual's consent. Often, occupational health clinicians suggest sharing any workplace recommendations with managers, and this is just to help put a plan in place, but keep any sensitive information out of the report. Importantly, there are some rare exceptions to data sharing without employee consent that would warrant a breach in confidentiality. Some examples would be if the employee presents a safeguarding risk or a risk to others and is unwilling to share this information in order to manage these risks. So, coming back to the scenario of being worried about a colleague's health at work, offering or signposting to occupational health referral is always a good option. Occupational health helps with confidential data gathering, analysis of the situation, and making a plan about what to do next. Occupational health helps managers with clear guidance on how to support colleagues with issues at the work health interface, without putting the manager and the employee in an uncomfortable position around information sharing. Occupational health helps build trust, care, and accountability when it comes to supporting colleagues with issues at the work health interface. In summary, looking out for colleagues' health at work is always important. But when you notice something that concerns you, it may not be appropriate or even possible to appraise or manage the situation end to end without confidential and clinical support. Occupational health can help with this, and in doing so, deliver results for the individual and the organisation. There are a lot of useful places to read about confidentiality in healthcare, and here are a few key texts and guidelines that have been referred to in this video.